Our bodies are excellent communicators. Sometimes these messages can come in the form of pain, aches, or discomfort, but other times they might come in the form of excitement, pleasure, or even relaxation. When it comes to cancer, early detection is critical, and your body can often provide some clues to warn you that something isn't right. So in today's video, we will tell you 12 early signs of cancer. So please watch the video till the end and subscribe to the channel. Let's start from point number first, fever. Persistent fever, particularly one that recurs without a clear cause, can be an early indication of cancer, especially blood-related cancers such as leukemia or lymphoma. In the case of leukemia, cancerous cells crowd out healthy white blood cells, which are crucial for fighting off infections. This compromised immune function can lead to frequent infections and a persistent low-grade fever as the body struggles to combat these infections. Lymphoma, which affects the lymphatic system, can similarly cause recurring fevers as the body's immune response is disrupted. Additionally, some cancers release substances that can trigger fever as part of a paraneoplastic syndrome, where symptoms are caused by substances produced by the tumor or by the body's immune response to the tumor. This can be seen in various solid tumors as well. Moreover, cancers can spread to different parts of the body and create inflammatory responses leading to fever. A fever that does not respond to usual treatments or occurs alongside other symptoms, such as night sweats, unexplained weight loss, or fatigue, should not be ignored. Persistent fever can also be accompanied by chills, which might further indicate an underlying serious condition. The fever can vary in intensity, sometimes being low grade and sometimes spiking high, adding to the discomfort and signaling the body's ongoing battle against an internal issue. It's important to note that while fever is a common symptom of many benign conditions, its persistence and recurrence warrant thorough medical evaluation to rule out or confirm the presence of cancer or other serious illnesses. Number second, weight loss. Unexplained weight loss, especially when it occurs without a clear reason or significant changes in diet or exercise, can be an early warning sign of various types of cancer. This phenomenon often arises because cancer cells consume a significant amount of the body's energy as they grow and multiply. Additionally, some cancers release substances into the body that alter the way food is converted to energy, contributing further to weight loss. This is particularly common in cancers of the digestive system, such as stomach, pancreatic, or esophageal cancer, where the tumor directly affects the body's ability to process and absorb nutrients. In the case of stomach cancer, the presence of the tumor might cause early satiety, leading to reduced food intake and subsequent weight loss. Pancreatic cancer, on the other hand, can interfere with pancreatic enzyme production, crucial for digesting food, thereby leading to weight loss despite normal eating habits. Furthermore, lung cancer can also lead to significant weight loss as the body works harder to fight the disease, often leading to a decreased appetite and increased metabolism. If a person experiences a noticeable and persistent drop in weight, typically defined as losing more than 5% of their body weight within 6 months, without a clear explanation, it is essential to seek medical advice. Number third, persistent headache. While some might see it as a minor case, it is important to know that persistent headaches can sometimes be one of the signs of cancer, especially if such headaches don't go away despite taking different kinds of medications for them. A headache can sometimes be referred to as cephalalgia. It is a sign of discomfort in the head, neck, or face, and can somehow come as a cluster headache, which normally does occur around one of the eye areas, accompanied by red eye or tearing, and a tension type headache, which is experiencing pressure on both sides of your head, or perhaps a migraine. One of the causes of severe headaches can be cancerous tumors in the brain. This tumor increases the pressure inside the skull, which can lead to severe pain in the head. While inflammation, dehydration, nerve compression, eye strain, or stress are far more common causes of recurrent headaches, brain tumors can also be seen as being associated with cancer. And having these tumors along with pain truly rings a bell that something is definitely not right. So, if you ever experience a different or new kind of pain over time, especially if you feel serious pains whenever you wake up in the morning, you might want to consider addressing it immediately, as this could be a brain tumor, which is definitely a sign that cancerous cells are growing in your body. Number 4, changes in bowel movement. Having a regular and consistent bowel habit is very important for removing waste from your body. But there could be other times that these regular habits can become a problem once altered. Bowel changes can be a symptom of cancer, and anything that differs from your regular stool might likely be a cause of concern, especially if this symptom persists for more than 2 days. For example, seeing blood in the stool may mean that you may likely have colon cancer. For some people, you may have noticed these changes, which might have caused you to panic. This could be a sign that there is bleeding in your intestinal tract or rectum. Sometimes the bleeding is not visible. Other times it can only be detected if a blood test is done to see the level of red blood cell count in your body. You could also experience frequent diarrhea or constipation, abdominal pain, or even cramping. However, these symptoms can be caused by a variety of cancers, such as colon cancer, rectal cancer, and ovarian cancer. They can also be caused by other conditions like hemorrhoids, irritable bowel syndrome, IBS, and diverticulitis. Other signs to look for, according to the American Cancer Society, are pain during waste removal, very dark or light-colored feces, and mucus. If you see any of these symptoms, do not hesitate to consult your doctor. You will most likely be referred for a colonoscopy or any other screening to determine what's going on with your body. Number 5, changes in urine. Aside from your typical bowel function, your bladder function should be consistent. But what changes should you pay attention to? You might likely need to check to see if there are any changes in the intensity of your urine flow, your urine color, or the urine smell. That is, if there is any strong and unpleasant odor, or if you observe that your urine is foamy or bloody. It is important to note these common early signs of bladder cancer, especially blood in the urine, which is also known as hematuria. Sometimes the color of the urine might look normal, but when a urine test or urinalysis is done, one might tend to find some small amounts of blood because of the symptoms a person is having. For some people with bladder cancer, they might likely see the blood every day when they urinate. Other times, you might experience situations where you have to either use the bathroom more frequently, feel a constant urge to urinate, or experience a weak stream. These changes could be primarily caused by bladder cancer or other cancers like ovarian cancer. So, whenever you notice any of these changes, do not hesitate to consult your family doctor. You might get an examination where you will either be diagnosed to check for infection or be recommended to further screen for urinary or other kinds of cancer. Number 6, bruising. Bruising occurs when blood accumulates under the skin as a result of an injured or ruptured fragile vein that usually pumps blood into the body. A bruise can be flat and will sometimes appear reddish or bluish at first, which can later fade to yellow, brown, or purple as those cells die and are absorbed back into the body. Bruising may also be caused by an imbalance in the body's bleeding or clotting system due to too many or too few platelets in the bloodstream. These platelets, like the red and white blood cells, are mostly generated in the bone marrow and play a vital role in blood clotting. And having too many platelets can form blood clots, which can lead to a heart attack, stroke, or other complications. However, bruising or an excess of platelets may indicate that your blood cells contain leukemia cells, which can grow in the bone marrow alongside healthy cells. These bruises are not like the ones we're used to seeing. They may be much darker red or purple and oddly shaped. Some cancer-related bruises may form in some places in the body where they should not normally occur, like the head, face, thighs, or back. They can even last longer and may appear to spread or increase. So if you ever get to see any of these signs, ensure you consult your doctor on time so as to proceed with treatment. Number 7, vision or hearing problem. We all know the vital roles the eye plays in our body, and many have ignored some of the signs that their eyes have shown to indicate that something is different from normal. Having vision and hearing problems can definitely be signs of cancer. Many people with eye melanoma do not have symptoms until the cancer spreads to specific areas of the eye or progresses. However, these symptoms might be caused by less serious illnesses, just like floaters, for example, which can be considered an everyday part of the aging body. Some of the changes to look out for around your eye region are problems with eyesight, such as blurry vision or sudden loss of vision, floaters, which is simply noticing any spots or squiggles moving in your eyes, or flashes of light. Visual field loss, which is also seen as a missing portion of your field of vision, a growing black spot on the colored region of the eye, a change in the size or shape of the pupil, a dark spot in the middle of the eye, a change in the location of the eyeball within its socket, and changes in how the eye moves within the socket. You might also experience some level of pain around your eyes, which could mean that the tumor has spread significantly outside the eye. For hearing, ear cancer mostly develops when abnormal cells in the ear start to grow and spread in an uncontrolled manner. Some of these cancers begin in the skin around the outer ear, while those that originate in the middle and inner ear are mostly uncommon. So the main symptom of this cancer could be when someone spots a sore or some odd changes on the ear flap that don't heal within 4 weeks. If you ever get to notice changes like discharge from your ear, loss of hearing, a lump in the ear, weakness in your face, bleeding from the ear, or even any form of pain around the ear area, there is every tendency that it's a sign that cancer is probably growing around such an area. So ensure that you seek the help of your doctor right away so that the cause can be identified and treated. Number 8, persistent fatigue. This isn't the usual tiredness you get after a hard day at work or play. We've all been tired at some point, and some of us experience it on a temporary basis. It could be because of stress, sickness, or burnout. Some people have continuous fatigue, which interrupts their daily lives. However, when fatigue becomes very common, it's natural to wonder what could probably cause it. When we talk of cancer fatigue, we aren't referring to the usual tiredness. It's not the type of tiredness that can be overcome with a good night's sleep or a cup of coffee. If one is experiencing this, there could be a tendency that an abnormal cell is literally growing in the person's body. This kind of fatigue might also make one upset because they are unable to participate in their normal daily activities. One might also experience anemia. Anemia occurs when your red blood cell count is lower than normal or your hemoglobin levels are abnormal. Speaking of hemoglobin, it is the most common component of the red blood cells that transports oxygen to tissues and organs. Lack of these red blood cells can reduce the oxygenation level in your body, leaving you feeling weak and fatigued. One can also tend to experience leukemia or lymphoma, which damages the bone marrow and disturbs the normal production of blood cells in the body. Diseases like colorectal or stomach cancer occur as a result of blood loss. Additionally, if you don't maintain a healthy diet, there might be an iron deficiency in your body, which could cause anemia. Remember that cancer uses your body's nutrients to grow and develop, which means that they are no longer refilling your system with nutrients. So you might likely need to pay close attention to your body so as to be able to detect these changes. And if your symptoms are severe enough to impair your quality of life, do well to contact your doctor for further screening. Number 9, swelling or lumps anywhere in the body. Swelling or lumps anywhere in the body can be a cause for concern, but it's important to remember that it's always best to get them checked out by a doctor to be safe. So if you ever get to see any new or persistent lumps or swelling anywhere around your body, don't hesitate to treat it seriously. For example, a bump in the neck could mean that there is a presence of head or neck cancer. Lumps are one of the most common symptoms of cancer in the body. Since cancerous tumors come from abnormal cell growth, these growing cells may tend to form lumps that can be felt under the skin. Additionally, when it comes to cancerous cells, it doesn't have respect for place or body type, especially if it has to do with enlarging some inbuilt cells like the lymph nodes. These lymph nodes are part of the immune system and might tend to swell when there is an underlying infection or inflammation. So if the cancer cells spread to this area, it will cause them to increase in size, thereby creating a form of swelling around that part of the body. Based on this, ensure to communicate with a medical professional if you see any lump that has refused to go away and is growing quickly and in an unusual location. Number 10, skin changes. Skin cancers are cancers that grow in the skin. They are caused by the formation of strange cells with the ability to penetrate or spread throughout the body. Skin cancer is the most frequent kind of cancer in humans, and its symptoms vary greatly. These include non-healing skin changes, ulcers in the skin, discolored skin, as well as changes in existing moles, such as jagged edges, enlargement of the mole, changes in color, texture, or hemorrhage. Other typical indicators of skin cancer include a painful rash that itches or burns. Number 11, coughing or hoarseness that does not go away. When you're unwell or your lungs are irritated, your body responds by coughing, which is your body's defensive mechanism for removing any mucus, allergies, or pollution so that you do not continue to breathe them in. But when the cough or hoarseness doesn't go away, it becomes alarming sometimes, as it can probably be a sign of cancer. Hoarseness is a common thing to experience, especially when you have a cold or after a loud applause during a sporting event. However, if your hoarse voice or cough persist for more than 3 to 4 weeks, you should consult your doctor. That's because hoarseness can be more than just a nuisance. It can be caused by a lot of treatable conditions. Ideally, your voice is usually formed whenever air from your lungs flows through your vocal cords, which are also called the vocal folds in the voice box or larynx. So, as this air flows through the vocal cords, they tend to vibrate and produce sound. But in situations where this vocal cord is enlarged or inflamed, it can lead to hoarseness. Number 12, unusual bleeding or discharge. Unusual bleeding or discharge, which is unexpected and unexplained, can be an alarming early sign of cancer, and it is essential to pay close attention to these symptoms. For example, blood in the urine may indicate bladder or kidney cancer, and even small amounts of blood can signify a serious issue. This symptom often occurs when a tumor grows and disrupts the normal function of the urinary tract, leading to bleeding. Similarly, blood in the stool can be a sign of colorectal cancer, particularly when it is dark and mixed with the stool, which suggests that the bleeding is occurring higher up in the digestive tract. In women, unusual vaginal bleeding, especially between periods or after menopause, can be an early warning sign of uterine or cervical cancer. Such bleeding can result from the presence of tumors in the reproductive organs, which disrupt normal tissue and blood vessels, causing them to bleed. Furthermore, nipple discharge, especially if it is bloody, can be an early symptom of breast cancer. This discharge may occur without squeezing the nipple and can be accompanied by other changes in the breast, such as lumps or skin changes. Other types of unusual discharge, such as a persistent and unexplained foul-smelling discharge, can also be a sign of infection or cancer, especially in the reproductive organs. For instance, ovarian cancer can cause a buildup of fluid in the abdomen, leading to unusual discharge. It is crucial to recognize that while there are many benign causes of abnormal bleeding and discharge, such as infections, hormonal changes, or minor injuries, persistent or unexplained symptoms should always be evaluated by a healthcare professional. Diagnostic tests, including imaging studies, blood tests, and biopsies, are essential to determine the underlying cause of these symptoms. So if your hoarseness persists for more than 3 weeks, or if you have other disturbing signs such as a lump in your neck, pain when speaking, severe coughing, or difficulty swallowing, ensure to contact your doctor for a proper evaluation and peace of mind. And that's it. Aside from trying to memorize all the signs and symptoms of cancer, you can also pay close attention to your body and ensure to consult your doctor if you experience any unusual symptoms. Thank you for watching. We know this video was educational to you. Let us know your thoughts in the comment section. And don't forget to like our video and subscribe to our channel for more educational videos. See you in our next video. Bye.